Hi, I'm Dr. Rami Turner, and today we're going to do the second part in a series on personality disorders. My first video was an overview of the different personality disorders that there are and how they're grouped together, and a little bit about some statistics about personality disorders and things like that, some of the ramifications. You might want to go back and review that so you'll know what the series is going to be covering. And we shall move forward today on some of the signs and symptoms that you might see in a person with personality disorder so that you can determine whether or not you need to look a little bit deeper. Each of these signs and symptoms by themselves doesn't necessarily mean a personality disorder. What you need to consider is how often and how severe and how many of these different signs are happening often and severely to determine whether or not a person might have a personality disorder, as opposed to needing to go seek professional help for another problem such as anxiety, or maybe seeing a doctor for hormonal problems, which could also be causing these same symptoms. So as you look at it, please don't diagnose someone with this one thing and decide that that's what it is without having a professional see them to determine if there's something else going on. Some of these disorders or some of these signs that I show you are like exactly the opposite of each other. And you'll see that as we go through because some people are more introverted, extroverted, you'll see. So without much further ado, let's just move on to what you can see in a person with a personality disorder. Frequent mood swings. When someone is especially rapidly changing their mood, that means that they probably need emergent professional help. But if they have mood swings, which like every day is different, you just never know what you're going to run into, or they just snap and quickly go from one mood to another, that is one sign that they may have personality disorder. Generally, it's hot and cold. Second one is angry outbursts, where they get angry and they just lash out at whoever, and who hasn't had an angry outburst? There's where you need to look at frequency and severity again. I can't stress that enough. Most people who have an angry outburst know that they had one. They feel bad about it. And we'll talk about that in a minute. Social anxiety is another thing that by itself doesn't necessarily mean a personality disorder, but a lot of people tend to have social anxieties with this, or they go the other way and they want to be the center of attention. They want everybody to be paying attention to them. They either want you not to look at them at all, and they're very reclusive, or they're very secretive, or they are it. Okay? They need to be it. And another symptom would be that they feel widely cheated by pretty much everyone they're taken advantage of all the time. Now, sometimes we are taken advantage of, and that's normal to feel like you've been taken advantage of. But when you notice that this person always seems to be the common denominator in whatever tragedy that occurs, and somehow they've been hurt by this tragedy, and it's because someone else did something, that's a sign that there might be a problem. Also, difficulty delaying gratification. They can't wait. They want a car, they go buy it now. They want a new furniture, they go buy it now. They don't save very well. They don't want to wait. They want something and they want it within 10 seconds. It's a sign of a personality disorder. In a teenager, it's a sign of being a teenager. In a 2-year-old, it's definitely a sign of being a 2-year-old. In an adult, it's time to stop. But the world does have a tendency to want immediate gratification. Amazon.com. The next one is probably one of the most significant signs, and that is the person doesn't feel like there's anything wrong with the angry outbursts or the need for instant gratification or for blaming other people for their problems. They don't think there's anything wrong with that. So it's really difficult to work with that. But when you see that, it's a sign that maybe you need to look deeper into whether or not it's a personality disorder. Now, there are other psychological conditions that can create that same type of scenario, but they warrant a psychological evaluation, perhaps a psychiatric evaluation. The last one is externalizing and blaming the world for one's own behavior and their feelings. And that's a tough pill to swallow, because who doesn't want a scapegoat? Who doesn't want it to be someone else's fault that they acted out? I mean, really. But the thing is that in this situation, it tends to be a recurring thing. It's always out there, and it's always someone else's fault. And we can't control other people's feelings and behavior. How? How could we? Now, we can do mean things, and they could feel bad because of it, but they can also decide, boy, am I sure glad that I learned that you're a creep. I'm moving out, or leaving, or getting out of this situation, or finding some other way to deal with this, finding someone else to satisfy the things that you don't, and they leave the relationship. So I will be doing a new video on probably paranoid personality disorder, because out of cluster A is probably the most damaging. And then as I move forward, I'll move to the more dangerous situations in the cluster B, and then we'll go back to cluster A and cluster C. If you don't know what the clusters are, go back to the first video and you'll understand. Check you on the next video. Thanks for watching. Please like and subscribe, share with your friends.